to our team, Wellbeing Without Borders. To our three speakers, I want to start with a big picture questions. When you hear that phrase, Wellbeing Without Borders, what does that phrase mean to you personally and professionally in the context of this planetary crisis, specifically within your own field? Dr. Rizwan, maybe you can start us off from the environmental side. Please welcome Dr. Rizwan.
All right. Okay. Assalamualaikum warahmatullahi wabarakatuh. Thank you very much, Dr. Aini Puasa, for throwing the first questions. I think that is quite important for us to ponder. Okay, the theme of the discussion today is well-being without borders. And I believe that this phrase or this term is very powerful to me personally, because it reminds us about our health, our survival, and also the future of the humanity, which is the future of our new generation. And it is no longer a local issues. Okay, it's a regional, it's an international issues, and we are sharing the same globe, we are sharing the same planets, so we are sharing everything. So that's why it's nothing to talk with the borders. So we have to be beyond the borders rather than confine us to our regions. And on my personal perspective, this phrase reflects a simple truth that the air that we breathe, the water that we drink, the food that we eat, okay, and those are the things that do not recognize the boundaries. Okay, perhaps the thing that we are using now, that we are using today, it comes from other regions. So that's why it don't have any, it's a borderless one. So on my personal perspective, I believe that if we keep on confining ourselves into our region without thinking the future generation, the people of other side of the world, so somehow we can compromise, okay, the future of the planet. So that's my personal perspective on the term of, on the phrase, or the well-being without borders. All right.
Thank you, Dr. Rizwan, for a powerful startup. Now let's turn to another angle. Dr. Nurolaini, what does well-being without borders in the context of planetary crisis mean to you personally and professionally in the pharmaceutical world?
Right. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh to distinguished panel speaker forum, and also Dr. Nurolaini. Nurolaini, is it? We share similar names. I'm a pharmacist by background, so planetary health is actually also just recently being discussed in the pharmacy area because of its significance that could cause devastating effect. We all know infectious diseases, climate change was discussed earlier this morning, biodiversity loss, complex food insecurity and everything, yeah, which could also affect resources. So I think personally, maybe this well-being without borders, to me, like it means we are all sharing collectively, as what Dr. Rizwan was mentioning. We only have one planet, yeah? So all this disease, pollution, climate impact, and supply chain across the borders happen, and we must tackle it together. So regardless which country we are, like we're very small, we're from Brunei, but just recently, for example, there's an earthquake in Sabah. So Brunei is also affected due to this earthquake, yeah? So we need to have this cross-country collaboration, shared learning, such as this one. Policies, we need to have policy to protect our people. And Dr. Naim this morning is talking about equity in health resources and education. So all this well-being without borders, as mentioned by Dr. Redzuan, we are not restrictive to where we are located by geography, yeah, or even wealth or status. So well-being is holistically, is a holistic terminology that we use nowadays to indicate that, to define more than just physical health. Now we're talking about mental health, social health, environmental health, yeah, cultural and also spiritual spiritual well-being. Okay, so recognizing these two, human health as well as planetary health, are therefore inseparable. In terms of professionally, as a pharmacist and academic, it is our responsibility to train our future pharmacists in the area of planetary health principle. We should be actively conducting research that links to health and environment. So we should empower our students by mobilizing these students, our youth, to do, for example, health screening to prevent NCDs, engage rural communities, as well as promote healthy behavior and environmental stewardship. Yeah, that's just from me.
Thank you, Dr. Nurolaini. That really changes the way we look at well-being without borders. It is such a reminder that even our most advanced science and research is still deeply connected to the natural world. Let's just move to Dr. Iqbal. Dr. Iqbal, from your perspective in patient care and mental health, what does this well-being without borders look like to you? Over to you, Dr. Iqbal.
Okay, yeah, thank you, Dr. Nurul. So, from our perspective in nursing, especially in nursing discipline, so this phrase can be interpreted as the first is about the global care, and then the second is about the quality center. So, what the global care means that so when we talk about the well-being without border, which it means that as a human being, people are deserve to be treated not only in a local system. I mean, they are deserve to get treatment and also caring from various variable. For example, when you see that the people come from Asia, so it doesn't mean that they should be get treatment only in Asian context. That's when we talk about the geographical location. Another thing is about when we talk about the without border, which means it's borderless. It means that the care it should be holistic, inclusive, and should be like transboundary nursing care. When you talk about the holistic, so as a nurse, we should give a care, not only consider human as a patient, but we should consider them as unique persons. So, which means that they have their need that cannot be the same each other. And also, we need to um, put the term inclusivity, which means that we cannot only select which person that we can give some care. How about some person that has some disability or some person that has some limitation on finance something? So all of them has the equal right to get the same treatment or the same care. So in terms of the planetary crisis, we should consider that our our planet. I mean, we just realized that now we have a crisis condition because of the global um, uh, warming and also global condition that happens in everywhere. We can see that many country having the same issue related with the, for example, air pollution or something. So it is related with the person, with the humans being as the affected person. So when we talk about the well-being without border in planetary crisis in nursing, so as a nurse, we have to consider everything like the people surrounding and people's condition and also the context of the country in everywhere as a variable that can affect the patient's condition. So, of course, with this, we need to collaborate not only with the healthcare professional, also with other, I mean, like non-healthcare professional. Of course, with the pharmacist, with doctor, and also midwifery. We always we work together. But today we should also work on, for example, like with IT person, because uh, nowadays the using of technology is very common and quite and become the top issue. Which is now we are trying to emphasize the using of this in implementing care of the patient. I think that's from me. Thank you.
Thank you, Dr. Iqbal, for sharing your perspective and for highlighting the importance of equalities and also collaboration. Ladies and gentlemen, we have heard from the environmental side, from the pharmaceutical side, and from the human perspective. It is clear that we are all living in one big interconnected system. Now that we understand the concept, and let's look at the reality. So I would first start with Dr. Rizwan. As an environmental expert, how do you relate the well-being of environment such as forests or river directly to the physical well-being of human being? If we continue to ignore the sickness of our environment, such as the pollution, water pollution, and so on, is it even possible for humans to achieve true well-being? What is your take on this, Dr. Rizwan?
All right, thank you very much, Dr. Aini. So basically, I see the environment is not as something separate or totally separate from us. So actually, we are living in the environment, and we can consider that the environment as the foundation of our physical health. So that's why we cannot run away. We cannot separate ourselves from the environment. So if we do something bad to the environment, we do damage to the environment, indirectly, it can affect our well-being, our physical health. So the air that we breathe comes from the forests, and then the water that we drink comes from the rivers, from the rivers, and also the food that we eat. It depends on the healthy soil and also the biodiversity. So when we destroy the forest, when we destroy the river, so that damage does not stay out there. So we have to put in mind that something that we damage is not remain at that particular period of time, and it eventually can enter into our bodies through air, through the water, and also through our food. And indirectly, it can affect our well-being. So today, science clearly mentioned that, or clearly shows that the connection between the pollution, the damage of the environment, can uh, damage or can implicate the human well-being. So, for instance, the air pollution can increase the lung disease or the heart disease. Okay, the contaminated water can affect the kidney and also the well-being of the new generation or the child development. And then the chemical pollutants can disrupt our hormones and also can impair our fertility. So these are the connections that being outlined, that being documented by science, that put the linkage between the damage of the environment to the human well-being. So in my field of reproductive health, we now see the emerging pollutants, which is microplastic, and some other toxic chemicals that can disrupt the well-being or the quality of the sperm, the pregnancy outcome, and also even can impair the fetal development. So that means environmental damage is not just harming us now. So it's also affecting our future generation that we should put into consideration now. So even this kind of pollutants can affect them before they are born. So if we continue to ignore the sickness of the environment, I believe that my answer for this question is we cannot remain in the damaged environment. So we cannot remain in this situation. So it's our duty, it's our responsibility to revive, to revamp, or to repair all the damage that we have done. So we may treat the diseases in the hospital. Yeah, we have advanced technology, we have advanced medical knowledge, so that we can treat the diseases. But another thing that we have to consider, for how long that we are going to continue treating the diseases, right? If the pollution continues, the new disease will keep emerging. Okay, so the new disease will keep emerging, and we have to find the new solution. We have to find the new treatment, the new medication in order to treat the new diseases. So that's the issue when we keep on ignoring the damaging environment that happen in our situation. So the true well-being requires the clean air, okay, the good food, the healthy food, the safe water, and also a stable ecology and also the climate. So without this, our well-being, our health cannot be sustained. So I would like to conclude that for this question is that if the environment is unhealthy, human cannot be truly healthy. So our well-being begins with the well-being of our environment. So that's why we have to put our environment as our utmost concern in order to make sure we can safeguard our future generation and also we can preserve our well-being. So with that, so that's my points for your question, Dr. Aini.
Good insight, Dr. Redzuan, on the linkage of environment and human well-being, and emphasize that we cannot remain in damaged ecosystem. Then I would like to take this further by asking Dr. Nurolaini, as a pharmacist and a medicinal chemist, you create the tools that we use to stay healthy. However, medicine has a borderless impact from production, manufactured to disposal. How can we link the human well-being in the context of pharmaceutical field to environmental well-being and health? Over to you, Doctor. Doctor, you are in mute mode. Can you please unmute?
Sorry. As a pharmacist and also medicinal chemist, so as you said, we created tools. I mean, medicine, we all know, created to heal us, but their impact does not end just in our body or in a patient's body. They can cross borders. So that's why you were saying about borderless impact, right? Because when we talk about drugs, once the drug are produced at a pharmaceutical, then they're out in the clinical area like hospital or health centers, patient consume it. Then after that, what happened? It's excreted out of the body. And where does that go? And it could lead to wastewater. And then that could lead to environment, ecosystem, and back to the cycle goes on. So basically, pharmaceutical emission contribute to around 4%, not a lot of the global carbon emission. But as we all know this morning from Dr. Naim talk, he was talking about that that index getting more and more. So we need to, although the amount is little, but still every little thing help, right? So 4% of the global carbon emission, including solvent used, say for example in a hospital or in pharmaceutical industry, and energy intensive synthesizing the drugs. So all of these chemical could also contaminate the environment. So once it's contaminating the environment, it could also be the water that we need to drink. We need to have a clean water, right? So this is what SDG are talking about, the Sustainable Development Goal, about access to clean water, health, and a food chain. It could also affect our food chain through bioaccumulation. And important things as a pharmacist, AMR, the drive of antimicrobial resistance, could also strengthen this global health security. Yeah. So even though when the medicine are used correctly, some of the drug, the non-metabolized drug, could be excreted and enter the wastewater system, as I mentioned earlier. And most of these wastewater treatment plant worldwide cannot fully remove the pharmaceutical residue totally. So some of the drug, as I mentioned, antibiotics in the river could be affecting the fish, the other animals, yeah. And this could lead to worsening of the AMR, antimicrobial resistance. So persistent chemicals could also affect biodiversity, soil health, as well as crop nutrition. And this leads to food security as well. In 2025, Global Review found that improper disposal is widespread as well, especially in household. This is similar to our study, whereby up to Well, our study may have a lower percentage. In this global review, it says that up to 95% of kept and unused medicine are often discarded incorrectly. So either they put it in a bin or trash it down the toilet. So this could be a problem, as I mentioned earlier, and this is the one that could affect the human health. So I mentioned about AMR, antimicrobial resistance. So these are like the environmental residue could select resistant strain, which can threaten the human outcome. And these are part of the planetary health crisis as well, yeah. Polluted river, we mentioned about polluted river. Fish population could be declining because of the pollution, and microbial balance could also be disrupted, and this could disrupt the food cycle, harm the food system, nutrition, and community livelihood. Yeah. What else? As a medicinal chemist, I think we can directly influence the sustainability of the medicine that we produce and design. We could now teach our students. This is something that we were not taught during my time when I did my undergraduate, but now it's very important. Even in FIP, they emphasize to incorporate planetary health in the curriculum. So we wanted to teach our students on how to design biodegradable pharmaceuticals that can easily break down safely. Perhaps we could use green chemistry, safer solvent, and renewable feedstock. Reducing synthetic steps in the making of the a drug process, or some energy intensive process. We could reduce this. The pharmacists who work clinically in a hospital, our role could be extended further now. Instead of just counseling, we could promote responsible medicine use, because by doing this, we prevent over-prescribing of antibiotic, reduce unnecessary prescribing, strengthening chronic diseases counseling to minimize waste. Yeah. We also want to implement, as a pharmacist, we have a role to implement pharmaceutical stewardship, returning back medicine back program, medicine take back program. We want to educate patient on how to properly dispose. If they cannot do that, they can return back to the hospital or clinic, and perhaps to educate those working at the logistic in terms of hospital waste segregation. Yeah, we could advocate for green pharmacy practice as well, to use lower impact formulation and support procurement of sustainability produced medicine. So overall, we know environmental well-being is also human well-being, and now we started talking about pharmaceutical sustainability is now like the key thing being mentioning, yeah, again and again. So I think that would be my perspective as a pharmacist.
Thank you, Dr. Nurolaini. Very insightful. I think that gives us something to think about on the relationship of pharmaceutical and environment, and the importance of planetary health in the pharmaceutical study. The next question is for Dr. Iqbal. As a nursing expert, Dr. Iqbal, focus directly on human well-being and patient care. And from your perspective, how is human health intrinsically connected to environmental health? Could you share your insight, Doctor? Please.
Okay, yeah, sure. Thank you, Dr. Nurul. So yes, exactly. Environment and human health is connected each other. So it's kind of it's affecting each other. The first, why I'm saying this, because okay, let's say the first is why humans health affecting the environment. The first, when we see that when someone get ill, get sick, and then they have some their limitation to do their activity. So based on this, it can cause how their behavior. And also when someone's sick, it can cause some waste as well. For example, when the person are using a catheter, or even they using a urinal bag which is contained of waste, and also when someone's using how to say, diapers. It can also can cause waste, which it can affect the environments. And at the end, it can cause also the global warmings. And then the other thing is when people sick, of course, they are not able to protect the environment, even the family and also the environment. So maybe the environment cannot. I mean, there will be some issue on the environment. And the other thing is, in contrast, when there is something happen on the environment, but let's say air pollution. Of course, it can cause the people's condition, humans' health condition, and of course, particularly for those who are in the vulnerable group, for example, low income countries or low income groups, and then older adults, which they are very vulnerable to get a serious disease, even in with this by the small thing, and then people with HIV, for example, or some other vulnerable groups, they are very affected when there's a changing in the environment. And then the other thing is, as we can see that right now we have a global one that is in my place, like maybe 10 years ago, I don't need air condition. So during my in my house, even though in the afternoon, of course at night I don't need the air condition. But right now I cannot sleep without air condition, even at night, because now is there's a global warming, so it can cause the temperature, and also the using of this air condition continuously, it can cause also some changes in the environment. And the other thing is about when we see the connection between humans and the environment, also the disease, this kind of triangle. So it always connected each other. So humans can cause the change in the environment and can cause a disease, and disease also can cause humans health and also like this. So um, again, in nursing perspective, it is very connected. So what should we do in the future? That's our homework. I mean, what should we do as a nurse to facilitate these three elements: uh, person, and also the environment and the disease cannot work together, which means that they can give a positive impact each other, not the negative impact each other. That's all from me, I think.
Thank you, Dr. Iqbal. It's great to hear your point of view on the interconnection of human and also environment and the importance of collaboration between us. For next question, Dr. Rizwan, from your perspective in environmental sustainability, could you help us map the landscape of current environmental crisis affecting our planet today? What are the key crises you would highlight, such as climate change, biodiversity, or any pollution? And how does each of these directly or indirectly impact the human well-being? Please, Doctor.
All right, thank you very much, Dr. Ain. From an environmental sustainability perspective, I can see that, or can say that today we are facing many crises. Okay, there are many crises on the planet that we are facing now, but today I would like to highlight the top three planetary crises that we are facing, and those three planetary crises, they are major one and they are interconnected emergencies. And before I highlight on the planetary crisis, I would like to reiterate what already been mentioned by a few speakers before this on the planetary boundaries. We know that in the concept of planetary health, we are surpassing already 7 boundaries in our planet. So we have two boundaries to go. Okay, that I would say that this one could be the um, uh, the the result from our what we are doing to the planet. So we have to make sure that we can preserve those two boundaries in order to make sure that our future generation can remain inhabit the planet. All right. So go back to the planetary crisis. The first crisis is on the climate change, and then the biodiversity loss, and also the pollution. So in regards to the climate change, okay, in regard to climate change, I believe that most of the planetary health conscious people or community, they are very aware on the impact on the issues of the climate change. So what are the situation that related to the climate change? The rising of the temperatures, the extreme heat, and then the floods, okay, the droughts, and also the unpredictable weather patterns that no longer can be. We cannot predict what will happen tomorrow on the climate, on the weather. So this is something that we are facing now. Okay, is a reality. We cannot deny on the impact of the climate change, and some people say that no, we are yet to having or to facing the climate change. No, we are facing the climate change, and it's about whether we are going to adapt, okay, the climate change. So we have to make sure that we are able to adapt with the climate change at the moment, okay, rather than we have to make sure that we can prevent, we can mitigate from the serious condition of the climate change to happen. But at the same time, we have to make sure that ourselves being more resilient and also be more adaptive to the climate change. So in regard to climate change, so it can directly affect our well-being, okay, the human well-being. Okay, the heat related, as some of the already mentioned just now, okay, the heat related illness, okay, sometimes can impair the sperm quality, that can impact or can indirectly affect our the sperm quality, okay, the food insecurity due to the droughts, okay, due to the flood, okay, so the massive floods can damage the crop, and sometimes due to the heat, okay, the global warming, okay, the crop very high tendency to fail in the yield. So this can create the situation of the food insecurity. And what will happen to the human well-being when we are facing the food insecurity is we don't have much nutrient in order to make sure that our well-being can be sustained. And then another effect of the climate change on the human well-being is on the mental health. So many people are talking about the mental health stress at the moment, and we have to make sure that we have to know that we able to prevent ourselves from having this kind of mental health stress. So we know that from the disasters, from the changing or the uncertain or unpredictable weather, it can elevate the risk of having mental health stress. So the climate instability directly affects our survival, our livelihood, and also on the long-term public health aspect. And another one is on the biodiversity loss. So we are seeing the losing of the forest, okay, the losing of the important species of the animals, the coral, the pollinators, the reef, and also the wildlife. And these are happening at an alarming rate, okay, at an alarming rate. So in Malaysia, particularly, so we are losing our Sumatran rhino, okay, and so what will happen next, okay, what's next species will extinct. So we are thinking on, we are counting days of the extinct of the species, but we are doing nothing. So it's our duty now. We have to make sure that we can decelerate at least, or we can prevent, we can stop the biodiversity loss. So it's our duty as the human well-being. So what will happen to our human, to the well-being of the human when we are facing the biodiversity loss? So it will reduce the food security because we are losing the pollinators, the fish. So we are losing our fish. So and then we lost our natural medicines, okay, and also our genetic resources, and at the same time, another thing that will happen if we are having this kind of biodiversity loss is we are at the greater risk of having or facing zoonotic transmissions diseases or spillover of the zoonotic transmission. So these are the impact of the biodiversity loss on the human well-being. And when the biodiversity keep on declining, so the ecosystem services that support the human life weaken. So our support system, the biodiversity is considered as our support system to live on this planet. So if we are losing this biodiversity, we are losing our support system, and indirectly we are in the dangerous state. And the last one is on the pollution. Okay, everyone knows about the pollution. People are talking about pollution, but how many of us know that pollution is a silent crisis? Okay, it's a silent crisis because it is less evident, is less visible, but it deeply impact or embedded in our daily life. So the pollution, okay, people know that pollution, air pollution can impair our respiratory system. It can cause the heart diseases, okay, the hormonal disruption, and also the infertility can happen due to the chemical exposure, whether you are knowing you are exposing or not. So that's another issue. And the last one is on the future generation. If we are exposing to the pollution, keep on exposing to the pollution, it can affect the genetic, and indirectly it can cause the increased number of the fetal abnormalities. So the future generation will be affected. So this pollution caters the environmental damage into the internal biological harm. So we are polluting the environment, but we have to know that at the same time we are damaging ourselves. So uh, to sum up, okay, environmental crisis, okay, is not just an ecological problem. It's not an ecological issue, but they are public health emergencies. It's a public health concerns, and we have to make sure that we are ready to face any kind of emergencies if we keep on damaging our environment. So that's all from me, Dr. Aini.
Thank you very much, Dr. Redzuan, for reminding us on the boundaries that we are reaching and the consequences on this. And Dr. Redzuan did mention about biodiversity loss. So Dr. Nurolaini, we would like to pass this question to you. Specifically, as we continue to lose our biodiversity, are we also losing the natural blueprints for future medicines? How does this biodiversity loss impact the pharmaceutical industry? And what are the potential consequences for human health and overall well-being? Could you share your insight, Dr. Raini?
Thank you, Dr. Nurul. So basically, yes, the answer is absolutely yes. When we lose biodiversity, we definitely also lose irreplaceable blueprint for future medicine. Yeah. So as a pharmacist, we all know that many modern medicine come directly or semi-synthetically or indirectly from natural product. So the likes of aspirin coming from willow bark, paclitaxel and anti-cancer agent are from Pacific yew tree, yeah, some penicillin from fungus, yeah, and all that. So this medicine exists only because the species exists. We found it way back from natural habitat, yeah. So definitely, if we lose all this, if we lose this biodiversity, the genetic makeup of the whole thing will be losing as well. So and some species on Earth, we haven't really fully studied them chemically, meaning we have to analyze the plant DNA and all that, yeah. And pharmacologically, even until now, we are still testing herbal drugs, yeah, or herbal plants by all means, testing their pharmacological active ingredient, yeah. We characterized it. We're working on that. So if they do go extinct, the chemistry will also be lost before we even discover it, right? So that's not a good thing. So all this drug production and drug discovery also derive from natural habitat. In terms of like soil microbes, especially, could also disappear due to the land use change and pollution. Dr. Rizwan mentioned about pollution is the third key thing, which is a silent crisis. Yeah. So with all this, microbial extinction could also lose the chance for us to discover the next antibiotic, for example, penicillin was discovered this way, the next life-saving antibiotic, which could be useful for other things needed with the rising of AMR, antimicrobial resistance. Yeah, so we need to protect by our biodiversity, and therefore which we could protect the health, our health as well. So biodiversity loss is also not just an environmental issue, it also have direct impact or threat to pharmaceutical innovation, drug security, and global health. So just briefly to mention the impact on pharmaceutical industry are like shrinking, as I said today, the natural chemistry library for drug discovery, threaten the supply chain for existing medicines. Some medicine are semi-synthetically derived from natural plant as well. So innovation, because of this, everything need to be synthetically made, and the rise of R&D will be increasing. In terms of impact on human health, fewer new drugs for cancer, infections, and all chronic diseases could also impact the human health, greater vulnerability to pandemic. Remember, during COVID, everyone was looking for new drug to combat this COVID-19 virus. Yeah. So we have to go back to the existing antibiotic to treat them, but eventually we make do with the vaccines. Yeah. So all this could also impact human health, increase health inequality, and also lower overall resilience and well-being. So to conclude on pharmacy side, I think overall protecting biodiversity will means protecting the future medicine and overall protecting human well-being. Yeah.
Thank you, Dr. Nurolaini, for your insight. And building on the question of COVID-19, which is much closer to us and to me as well, as I'm one of the patient of COVID-19 previously. So I will pass this question to Dr. Iqbal. Your research highlight the deep psychosocial impacts of global health crisis recently in COVID-19. So when we look at the planetary crisis, Dr. Iqbal, it isn't just a physical threat, it is a mental one. And how is environmental instability, such as extreme weather or resource scarcity, contributing to eco-anxiety or mental distress? And how does this in turn affect the overall well-being of communities? The floor is yours, Dr. Iqbal.
Okay, thank you. Wow. Nice question. Yeah. Yeah, related with the COVID-19, yeah. Until now, I'm still do study related with the not because COVID is over, right? It's not the pandemic anymore, but we're still running a research related with the like preparedness or disaster, not on the physical, but it's kind of we're trying to prepare if a disaster like COVID-19 happening again in the future. We hope it will not happen anymore. So related with your question, yes, of course. When we talk about the uh, disaster or okay, let's say the climate change. Yeah. So the climate change is like it's like a disaster, but it's not a physical. So when we are, so let's flew back to the COVID-19 in the 2020. So the impact of COVID-19 at the time is very terrible. I mean, people are fear, so people are worried, always worry, always. So of course they are very anxious. So when you talk about the how it's related with the you're asking about the eco anxiety, right, Dr. Nurul? So, the impact of the COVID-19, it can cause like the sustained uh, trauma of the patient, especially for those who are experiencing, I mean, those who have experienced as a COVID-19 positive patient. So based on this, they are very we call it, in nursing or in psychology, there's a term that they call it, or a disease that they call it PTSD, post-traumatic syndrome disease. So a lot of patients, a lot of people experiencing some kind of this disease, the PTSD, after the COVID-19 is over, especially those who are experiencing a COVID and passive, or those who just get loss of their family or their relative. So of course it will relate it with the resilience of doing their life, of course, and it is very connected with the planetary crisis. Why is connected? Because when people have the fear condition for a long time, based on their past experience, of course it can cause their behavior. Their behavior will be changed. That's why we have there's a new era after COVID-19, that we call it post COVID-19 or new era. That everything is changes, and um, when we try to link between the mental health and the planetary crisis, of course, when you see that one of the reasons why the planetary crisis is happening is about because of the people's behavior, because of the humans' behavior. So this humans' behaviors is related with their emotional condition. Those who are having the unstable emotional condition based because of the PTSD, or because of the trauma that they're experiencing before, of course, it can be through affecting the behavior. And another thing is about uh, when we talk about the impact of the COVID-19 on the planetary crisis is, I think there's some positive impact as well instead of the negative impact. Yeah, why? It's happening in our university, in Unpad, in our university. Since 2022, we are declared our university as the hybrid university. Even though right now we are shifting again to like the full offline university, but during this period, during the hybrid university, the number of people who came to the university is reduced. Of course, the number of vehicle came to enter the university also reduced as well. And it's kind of a small example that the air pollution is reduced based on this policy. So it's happening because at the time we try to reduce the number of people to prevent the transmission of the COVID-19. Instead of negative impacts, of also it can give a positive impact also. So yeah. So that's why there's always a bright side of the disaster. Yeah, yeah. I think it's for me.
Thank you, Dr. Iqbal. That's very informative on the PTSD or trauma that can impacting our behavior, and also highlighting the positive impact of COVID-19, which we don't even think about and realizing about the positive impact on it. So the next question for Dr. Nurolaini, you mentioned that medicines wastage, leakage into our environment can harm both people and the planet. How can we empower communities to move from feeling like victims of the planetary crisis to taking responsibility and acting proactively beyond just cleaning up the mess by lack of awareness? Dr. Aini, please.
Thank you so much. So in order for us, thank you for the question, right? So we're talking about medicine wastage leak into our environment, yeah? So how can we empower? The question was, how can we empower community to move from feeling like a victim, right? So we need to empower this community, our own community. Just now, when we mentioned when mentioned by Dr. Naim in the morning, we need to work with our community. They're the one who already practice sustainability. We are the one very restrictive, very like maybe we used to do things differently than them. So the key takeaway that I take from Dr. Naim this morning lecture, or session, was mainly like he was saying, talk to your community, listen to them, and the proactiveness should be from bottom to up, not the usual top to bottom approach, he said. So we need to empower our community to take share responsibility and act proactively. We need to create awareness. I think that's my main point. We need, as an academic as well, likewise, each of us have our own role in our university. We could, with this awareness, we could start with a baseline data and start educating public. At the moment, these things are new as well for us in UBD, yeah. Sustainability thing. It was never implemented in our curriculum. So only now when we start to reform our curriculum, we want to embed planetary health and pharmacy. What's the role of pharmacy? So awareness, yeah. So from upstream action, we need to improve prescribing practice, start low, go slow, and shorter refills. Yeah. So because once you give people their meds in 3 months, that's a lot. So this could lead to wastage. We need to encourage medication review for elderly, especially who are taking a lot of medicine, to reduce overstocking. We could promote proper storage to prevent spoilage, and advocate for government policy to support this return back your medicine if you don't need them. Yeah. From the community itself, awareness, we could create awareness, only buy what's needed. I think a colleague of mine in the pharmacy team have done a survey as well on during COVID, how much people are stocking up the over-the-counter medicine, yeah, just in case, yeah, because you were put under isolation, cannot get out from your house. So it's interesting how the behavioral has changed. So we need to educate people. Do not need to stock everything at home, yeah. Your house is not a pharmacy. So only buy what is needed. Keep an active inventory of household medicine. So things which are not needed need to be get rid of. Return, not stored. And any expired or unused medicine can be returned at the pharmacy. We need to build capacity besides awareness. Yeah, I think this was also mentioned in the previous speaker visit from Mahidol just now. We need to give people tools and skill, train the trainer models for community leaders. So, for example, we have kampung, ketua, whatever, in the school will be principal, yeah, or the community nurse, the leader nurse, teachers as well play important role on safe medicine disposal. This one our student was doing on one of our community project was on health literacy. So they also teach how to store your medicine safely and how to dispose your medicine safely. Equip communities with actual access points. So, for example, provide QR code to indicate where is their nearest hospital to return their medicine. Yeah. Build partnership with schools, clinics, and also local leaders. I think I've seen as well in the morning session talking about this, which was implemented globally outside our region, whereby they integrate this medicine take back into the health centers, in schools and mosque perhaps, and supermarket. They use like a maybe little sticker, not just to say label, do not flush, return to the pharmacy kind of thing. And perhaps we could also create environmental stewardship, meaning we want to create a community. It doesn't mean like what Dr. Naim was saying, doesn't mean you have to start big. Small community, green health ambassador, eco-pharmacy champions, yeah, to celebrate in schools and individuals. So we need to empower our own community to prevent medicine wastage. I think that's mainly my point.
Good insight, Dr. Nurolaini, on encouraging awareness, education, greenhouse, communities engagement, and also, ladies and gentlemen, please remember that your house is not a pharmacy. And the next question, I will pass to Dr. Iqbal. When we talk about planetary crisis, it can feel like a massive problem and overwhelming. As a health expert, how can we empower individuals from a single patient to entire communities? And what practical steps can the healthcare providers suggest to so that people can see their daily life choices and also their lifestyle as helping both their health and also their planet? Dr. Iqbal?
Okay, yeah, thank you for the question. A nice question also. Yeah, I think this question is similar with the someone's question on the chat box, right? Someone's asking me about, yeah, I think it's similar with your question. How can nurses effectively advocate for environmental stability while remaining within their professional scope of practice? Okay, so yeah, correct. You're asking in nursing field, right? As a nursing practices, right? Yeah, as a nursing practices, what should we do? I mean, to emphasize to emphasize a community, to have a good habit, right? To keep their behavior positive, to give a positive impact on our planet and also on their health. Yeah, the first is when you talk about the behavior is related with always related with the um, health promotion and health prevention. That's we are working on right now. The most important thing, because when we see about the health promotion, it always related with the people's behavior. It always related with the community behavior. How to make them uh, shifting their behavior to be a positive behavior. So there's a strategy that we call empowerment. The first is empowerment. How we empower people. So to do the empowerment, of course, we need to understand what is they need. We need to understand what exactly the need in some community, which can be diverse from other community. For example, if we see that there is uh, not a pandemic, there's for example, epidemic or in some area. For example, uh, uh, maybe lepra, yeah, uh, 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 or maybe tuberculosis, yeah, tuberculosis in some area. So the tuberculosis can affected by various factors, internal and external. So the internal factor, which is because of their behavior, for example, whether they're smoking or not, whether they have good vibes. I mean, whether they have a good, they're trying to spread positive vibes to their environment, whether they communicate each other, not isolating themselves. So it's kind of something that not easy to make them to do that. So by the empowerment, we can see that among them, they will support each other. Among them, they will try to educate each other. So there will be a bonding among them. And the second is how we try to involve the policymaker or the government in this case to give a strengthening, to give a support to them, because to change the behavior of in some population, it cannot be done without a policy. We as a healthcare professional only can, give some education, only can um, emphasizing them the importance of blah 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 something. But without policy, it's hard to do that. So that's why we need to work with the policymaker to create, to have a good or a comprehensive act or regulation to change their behavior. So based on this, we can achieve our goals. And related with the climate crisis. So when the community already, uh, their behavior already in a good vibes, and they support each other, and they are working together to always remind what should they do as a human, as a patient, not to distract, not to destroy our environment. Of course, it will affect it at the end. So again, we in nursing perspective, we have some role. So our role is like advocator, and then educator, and then the role model. So, but again, at the end, it will be depends on the patient or the community itself. We're just trying to facilitate. We're just trying to emphasizing them, to empower them. So, and it's not easy, and it takes time. But once the community achieve they're in a good environment, they are in a good their behavior already in a good or a positive behavior, so it's easy to achieve their goal and to impact each other. I think that's for me.
Great, Dr. Iqbal, and thank you for the elaboration and emphasizing on the importance of policy to change the behavior. Next question is for Dr. Redzuan. Dr. Redzuan, your research mentioned on the microplastic impact on the reproduction. I'm sure that when we heard about this, many future parents may feel worried. How can we communicate these complex signs in a way that empower families to take informed action without causing fear or anxiety? Dr. Redzuan, the floor is yours.
All right. Okay. Thank you very much, Dr. Ani. It's very important question to highlight. Okay, because in field of science, okay, we are dealing with the findings from our lab research, from our research activities, from our studies. So how we are going to make our findings or our outcomes, our research can be accepted by the community. So because science communication is very important, so that's why at Planetiium we have the Planetary Health Communication Challenge. So in order to groom the new talent, in order to be the agent of disseminating information or knowledge with regard to the planetary health in a proper way, in an accurate manner. So the purpose of having science communication is not to create a fear or anxiety or worrying situation to the public. So it is about to create informed and also the hopeful action. It's not about creating fear or anxious. So when we talk from my perspective in my research on the microplastic and some other toxicants, yeah, it's quite challenging because when we have certain kind of findings, so we try to bring to the community. So it's like we are bringing something back to the community. So we have to make sure that the key message that we are going to disseminate to the community is not in the form of a threat, but we have to make sure that that kind of message can be understood as the key message on empowering the community. So it is about the empowering the community. So how to make sure that those kind of knowledge or information in science can be properly internalized to the community. It can start with several steps. So the first one, we have to start with the perspective. Okay, we have to bring them on a bigger perspective rather than just focus on single issues, right? So, for example, on this issue on the microplastic, all right. So we have to make sure that the message can be written or can be conveyed in the form of we know that the microplastic can pose a danger to the community, to the public, but we cannot explicitly mention about the impact or the issues of the microplastic. We have to make sure that there is a risk of the microplastic that we can reduce together. Okay, so we try to make sure that the public or the community can understand that the issues of the microplastic can be reduced when we are having a collective efforts among us. So rather than we just mention that we cannot run away, we cannot escape from the danger of the microplastic, right? So that's the first one. And the next one is we have to make sure that the complex science, yeah, because some people perceive that something that is related to science is very complicated, very complex, and some may think that it's a rocket science things. So we have to make sure that we're able to translate the complex science into everyday choices or into something that we can easily understand or layman can understand. So instead of discussing the molecular mechanism, the pathway, and those kind of complexity of the process of the how the microplastic, how the toxic can cause damage to the reproductive system, okay, we can focus on simple and practical actions that the families or the community can understand and can adopt. Okay, for example, we have to disseminate on the knowledge on how to reduce the unnecessary plastic use for food and also for drinks. And also we have to advise them avoid from heating food in plastic containers, improve in ventilation of this in the ventilation at home, and also we have to advise them to choose fresh food when possible. And these kind of small actions, or we call it as small daily habits, can cause the community feel it is something can be managed. Okay, yeah, we even though we cannot totally eliminate the use of plastic in our environment, in our daily life. So we have to make sure that it is something can be managed. All right. So we have to. It's like a hopeful situation or action to the community. So we give people a sense of control. So when they know that they have the power, we have the will in order to reduce or to manage certain kind of the impact of the pollution of the microplastic. So they have this kind of a hopeful action, right? And the next one is we have to frame the message and around protecting the future. So instead of creating fear or anxiety, we have to focus on care, prevention, and also positive one. So this kind of message, we have to make sure it can be reframed or it can be adjusted in the way that the community can consider it is something it's about caring, it's about prevention, and also it's about something is positive. So when we talk more, put more consideration or more highlight on the issues of the microplastic, the impact of the microplastic, somehow we create something is that it's like it's not a toxic environment, but it's something that we have to highlight. But we have to make sure it can be sent or it can be disseminated in the proper way and in the polite and in the positive thing. So the effective communication is not about alarming people. Okay, it's not about alarming people, but it's about helping them feel capable and supported. So that's much more important to be highlighted. So when science is shared with empathy, because most of us try to make the people understand about science, but we tend to forget about the empathy in science communication. So when we include the element of empathy, the practicality, and also the clarity in informing about science, so we can empower the community in order to make them be more confident rather than be in the fear or in the anxiety. So to conclude that, I believe that this kind of communication is very important, yeah, because it's a key thing that we have to make sure that people, especially the scientists, the researchers, know how to convey the message properly to the public. So that's my point on that question, Dr. Aini.
Thank you, Dr. Rizwan, for highlighting the good of translating the complex science to a layman discussion. And also, ladies and gentlemen, please remember that the tone of message to convey is not as a threat, but we have to convey them in a good way. So, building on this, let's move to the next question for Dr. Nurolaini. As Deputy Dean of Academic and Student Affairs, how does your organization support young leaders and students in driving community initiative, inspiring healthier behaviors, and empowering individuals to take responsibility for their health during the planetary health crisis? Please welcome Dr. Nurolaini.
Thank you, Dr. Nurul. So thank you for the question. Yes, we are here at a higher institution whereby majority of our stakeholders are the youth. So we recognize that today's students are tomorrow's health stewards. They are our future policymakers. They could be future doctors, dentists, pharmacists. They could be the innovators in the future, and also our community mobilizer. So in the context of planetary health crisis, where we mentioned about degradation of environment, climate change, floods, yeah, mentioned by Dr. Naim, NCDs because of flood, and there's a follow-up effect on health. Non-communicable diseases are on the rise. I think not just Brunei, Malaysia, Indonesia are the same. Climate change and widening of health inequities intersect. So our role as an academic at the university, at a higher institution, is not just to educate. We want to empower this youth to lead in the future as well. Yeah. So we integrate planetary health concept into both our core as well as elective module across program, ensuring students understand the environmental determinants of health, the health impact of climate and ecological degradation, and we wanted to know the youth responsibilities of healthcare and community actors in sustainable practice. As I mentioned, we have reform or revise our old curriculum into new curriculum. So this is what we've added. We actively support our health sciences students to also design, lead, and evaluate a community engagement initiative as part of their core module in what we call in medicine SSM. Self-study module 3, as well as in pharmacy, the pharmacy student do community project, community engagement, and the area of topic that they chosen are like on cancer awareness, screening campaign, NCD awareness, yeah, healthy lifestyle advocacy. We want to advocate health literacy to the community. So it's not just, when we talk about health, it's not just about losing weight and met a certain BMI. It's all about the whole healthy aspect, having enough sleep, drinking enough water, spiritual health, not just about losing weight or eating healthy, eating fruits and vegetables. Yeah, not just that. We also advocate our students to do medicine waste education program. We believe that because medicine are free in Brunei, so we don't want it to waste just like that. So we want community to understand, not just because it's free you're able to waste. Even in Islam, right, we shouldn't waste things. So we want to educate the public on that. Youth-led environmental health projects are also being encouraged. So through this mentorship and structured service learning components, students learn how to apply classroom knowledge in the real life setting. So especially I've brought students back in the years, a long time ago, I brought students to a very remote area in Brunei where we have there's no proper road. We have to use four-wheel drives, and these are very vulnerable group whereby even there's no Wi-Fi there. So we teach them first aid training, oral health, proper oral health, about hygiene and the basic things, health literacy thing. We equip students with competency they need to inspire healthier behavior, including, as I said, not just on about how to store your medicine, but also health awareness. They did this in one of the big shopping center in Brunei. They also involve influencer nowadays, influencer on healthy eating. They're very creative, these students. If you leave them alone, they could come up with a lot of ideas as well. I think it's all about what's current, what's the topic. We can mentor the student. Yeah. So I've also advocate my student to do on smoking cessation and vape awareness. Yeah, recently. And they will definitely create social media platform for innovation and student-led solution to reach out to the communities. So they also work collaboratively together with the Ministry of Health, pharmacists, for example, or doctors, the JPMC private hospitals, local community leader. They work with Pusat Warga Emas people, environmental organization, NGOs, schools, and also youth groups. So this partnership gives students authentic opportunity to contribute meaningfully to national health and as well as environmental priorities, reinforcing their effort for a real world impact. So I do believe our role as an educator to nurture a generation that does not see health and environment as a separate domain. Last time we only teach health to disease, right? But nowadays we want to incorporate health. What is the impact to the environment? It's interconnected. So they also need to understand that protecting this planetary system is central to protecting human health. So we do teach our students to empower our young people to think critically, to act compassionately, and to lead courageously. Yeah, I think that's all from me.
Thank you, Dr. Nurolaini. That add a lot of value on our discussion where other institutions should also apply the same as this for our future generation. So the next question will be for Dr. Iqbal. As head of internationalization unit, how does your organization support global partnership initiative that empower health worldwide to tackle this planetary crisis? Dr. Iqbal, please welcome.
Okay. Yeah. Thank you, Dr. Nurul. When we talk about the institutional policy, we have made some partnership with various partner overseas and also in our country also. So what has been done by us in terms of fostering or to empower the health worldwide to tackle the planetary crisis is we made some partnership in terms of the research and also in academic, mostly on academic and research. So what kind of research? The various type of research. There are several topic of research related with the climate change, related with the behavioral study, if it's about research. So we do some research collaborations with, for example, as we have did with university in Taiwan, we make a program that we call sustainable community empowerment for older adults with frailty. So with this, we work together to make some health promotion in terms of the frailty prevention among the older adults in two different countries. So of course, yeah, we make a program here, and our partner make a program there too. But we collaborate each other to discuss what kind of program that can be suitable and can strengthen each other. And also we do some program that we for example that including in this project is the faculty and student mobility. So we send our student and also to some faculty to our partner, and also we receive some faculty and associates from our partner to come to our university also, and they collaborate each other. This student and among the fact that they interact each other and then discuss and they learn each other what factor that influence the behavior on that country that might be different with their own country. And the other thing is, we also learn each other about how each government creates some policy to manage the issue related with the uh, in this project in term of the older adults frailty prevention. So from this, I think it is beneficial to contribute to the planetary crisis, especially how to make the vulnerable group like all the adults to adapt or uh, to deal with the climate change, and how to do some program related to the climate change that can be beneficial to older adults itself. And the other thing is we also have made some program as our support to the global partnership is like we have uh, um, involved in the how to say the association that we call it um, International Nursing Council, International Council of Nursing ICN. So through this association, through this international body of nursing profession, so we try to make a robust program that can be accepted in uh, various country, especially those who are involved in this group. So based on this, we learn each other and we support each other, and we can learn from the mistake that has been done by our partner, for example, and we can give some each other. We can give some solution or some suggestion. And the other thing is related with the global partnership is uh, uh, within this during these last 5 years, we have some grant to support the I mean to reduce the global warming. So we call it ISMA, International Student Mobility. I forgot to stand for, but this grant is support the student who want to go abroad and to make some project related with the global warming reduction, something like this. So based on this, we believe that it is beneficial and it can contribute to the uh, to our planet and to solve the planetary crisis itself.
Thank you, Dr. Iqbal. Such a
Yeah,
great initiative from your organization. And I believe this is a good initiative where other organizations should also look up for. And the next question for Dr. Redzuan. as a deputy director, I've seen Planetiium, or Institute of Planetary Survival for Sustainable Wellbeing, has established a regional consortia for planetary health. And Malaysia also has implemented its National Planetary Health Action Plan. From your perspective, why are these initiatives and collaborations crucial for empowering health in planetary crisis? Please welcome Dr. Redzuan.
All right. Okay. Thank you very much, Dr. Aini. Yeah. As I mentioned, that Planetium, we are initiating the agenda of establishing the Planetary Health Consortium, okay, regionally. Okay, so we have contacted few institutions across the regions, from Philippines, from Brunei, Indonesia, Thailand, and also the newcomers will be the Vietnam. So, and at the same time, Malaysia is the first country in this world that has established the National Planetary Health Action Plan. So these two agenda is very important, okay, in order for us to face the planetary crisis. And as we know that the planetary crisis is very complex and they are too interconnected for any single institution or any single country to solve alone. So it requires collaborative efforts from various institutions across regions and also among different entities in order to make sure that we able to solve the problem comprehensively. So as a solution provider, okay, we have to make sure that we have this kind of understanding. It's a collaboration, okay? It's a partnership. It's not about doing something in silo. If you try to be a champion in if you wish to be the it's a one-man show. It's not a one-man show. Okay, we have to collaborate. If you try to solve one thing, okay, without being in a collaborative manner, you are only solving the problem from one single perspective. So that's why we have to make sure that all the initiative that we are going to propose is something that involve collaboration and also partnership. So planetary health challenges, okay, as I mentioned, about the climate change, the biodiversity loss, and also the pollution is a cross-border, is a borderless. So the solution must also cross borders. Okay, it's not entitled to one single region or one single country. So the regional consortia that we are planning to establish can be a platform, okay, to share our research outcomes, the data, and also the expertise, okay. And the most important one is we want to avoid from the duplications of efforts. Okay, for example, in Malaysia, we are doing research on, for example, the microplastic. So microplastic is a new, it is an emerging toxicants. So many researchers want to venture in the research of the microplastic. So perhaps from Philippines, from Indonesia, there are researchers doing research on the microplastic. But the problem is we do not know what they are doing there in the Indonesia, in the Philippines. If we have the research consortia, we manage to know the research on the microplastic that being done by the researchers in Indonesia or in the Philippines from what aspects. Okay, perhaps from my research activity, I'm focusing on the impact of the microplastic on the prenatal exposure and also on the reproductive system. And some other researchers from Indonesia are doing from the different angle for the different system of the body. So if we have this kind of connections, okay, we can avoid from the duplications of the data or efforts, okay, and at the same time we can have a comprehensive and a solid findings in order to have a consolidated data on the research on the microplastic. So that's the second reason why we want to establish the regional consortium on the planetary health. And another one is when we have a collaboration, we have a consortium, we can have we can build a stronger and also faster solutions together. So perhaps by having several think tank from several countries, we can have a solid solution for certain kind of issues. And another one is about the capacities, about the resources. If we have the consortium, we can leverage, we can have a support from various countries in order to provide certain kind of resources or capacities. So these are the gist or the spirit of having the regional consortia. So we want to make sure that the collaboration the collaboration and partnership can be turned into the collective momentum. So if we want to stay on the isolated research project, or we don't want to collaborate with others, at least actually we are, it's like a champion in our own area only. So you are doing nothing to the regions. So at the national level, we have a national planetary health action plans. So this action plan is equally important because it translates the global ideas into the real policies and also the actions. So together, by having this kind of consortium and also the National Planetary Health Action Plan, we believe that the initiative to overcome the issues of the planetary crisis can be done in the proper way, and we can have in a collaborative manner, and we try to make sure that it can be coordinated at any levels that we have. So this kind of actions, okay, regional consortium and also the planetary health action plan, okay, it reflects, okay, our um, agency, okay, in order to solve the problems of the planetary crisis. So in short, empowering health during a planetary crisis, okay, it requires coordinated action. And also, we have to make sure that when we have this kind of collaboration, we have to make sure that we have a mutual agreement among us. So I hope that this kind of collaboration is no longer optional. It is no longer optional, but it is essential in order for us to solve the planetary crisis. So this kind of initiative by Planetiium, I hope that all members of the regions can fully support, okay, the spirit that we have for the regional consortium on the planetary health. So and also I would like to welcome all the members of the regions to be part of the initiative. All right. Okay. Thank you, Dr. Aini.
Thank you, Dr. Rizwan, for highlighting the importance of collaboration, working in system, not in silo, which I believe this is such a great initiative from Planetiium and for the beneficial of all countries in regional of the consortium. Let's proceed to our final reflection. So this question is to all the speakers. If these forums ends with one shared commitment, what collective pledge should we make today to ensure that empowering health is in a planetary crisis becomes a sustained movement rather than just a conversation? First of all, we would like to hear from Dr. Iqbal. Please, Dr. Iqbal, the floor is yours.
Okay. Yeah. Thank you for the question, Dr. Nurul. So, can you repeat again your question? I mean, is it related with the? Yeah. Sorry. Can you?
The question is, if this forum and with one shared commitment, what collective pledge should we make today to ensure that empowering health in a planetary crisis becomes a sustained movement rather than just a conversation?
Okay. Yeah. In this forum, so if we talk about our commitment to strengthen our effort or our yes, some kind of program related with the planetary crisis is um the first is we need to aware first this now our earth is not okay. Yeah, so we need to have a good awareness first about how important is the to to save our planet. After we aware, so of course we are we will have some idea, a lot of idea, and also some maybe some program to save it. So based after we have the awareness, it's very important to commit with our program that is not we need to make sure that the program is not aiming just to fulfill our the obligation only, but it should be aiming to really save the planet, to really make our planet healthier. And the third is it's very important to collaborate, to work together, because I always remember that if you want to go faster, you just go alone. But if you want to go further, you work together. So we cannot stand alone. We cannot work alone. We always need each other. We need Malaysia, Brunei, Singapore, and other country, and also we need each other. Nurse need doctor, need pharmacist, need a biomedical profession. Everyone among us, we need each other. So try to again to keep in our mind that we are not the expert in everything. Maybe me as a nurse, I know something about nursing, about how to nurturing, how to care people, but maybe I have nothing about how to prevent the polypharmacy in patient, by like how to select a good regimen to some patient. Maybe the Nurolaini is more expert on this, and also about how to make the plastic become beneficial. I need to learn from Dr. Rizwan. So if we are aware and we are eager to learn each other from a different perspective, of course, it's very important. I believe at the end we can have a good forum that can strengthen each other, that can make our planet become safer. That's from me, I think, Dr. Nurul.
Thank you, Dr. Iqbal. Such a good explanation and reflection on that. So the same question to Dr. Nurolaini. If this forum ends with one shared commitment, what collective pledge should we make today to ensure that our empowering health in a planetary crisis become a sustained movement rather than just a conversation? Dr. Nurolaini, we would like to hear your perspective.
Yes, thank you, Dr. Nurul. So I think first of all, let me applaud the initiative created by this Planetiium to create such forum like this. In fact, I was looking at your website. This is not the first one that you've done. You have covered biodiversity, climate change. You also invited one of our lecturer, Dr. Val, I believe. So yeah, so this is a very good initiative to keep this momentum going. Like I also like the idea, like what Dr. Rizwan was saying about forming a network. Yeah, so I think that should be our commitment, individual commitment, as well as us as governmental leaders must in fact work together to share responsibility to our only planet, because we have no choice. Like what Dr. Nai was saying during his childhood, flooding was one example, yeah, but now it gets worse. So we need to treat planetary health as our foundation. It's not an option because we live in it. And when planetary health become part of our institution, it's our day-to-day life. It creates a generation of graduate and professional who can see this sustainability as a normal, not as an exception. So like to be as an individual, as an academic, as well as researcher, as well as administrator, let this be our own commitment as well. And I applaud the participant who stayed here from morning 9:30, yeah, listening to this issue about planetary health. They are the one who are very committed in listening to us. So, but on my part, I commit to champion planetary health by forming a module, planetary health and pharmacy module for our own student. That's part of my responsibility. And I pledge to integrate sustainability into my daily choices and embed environmental stewardship into the heart of our institution. So may this not be the end of the forum, but the beginning of a movement. So it's a movement, yeah. Although it's small, like it's only 150 people coming, but it's still it means something. So therefore I would like to thank Planetiium from IMUM in terms of coordinating such a great conversation about planetary health.
Thank you, Dr. Nurolaini. It's great to hear from you. And also it's great to hear different viewpoints. Let us welcome Dr. Redzuan for your perspective.
All right. For this one, if we want to make sure that we manage to preserve our planet, to safeguard our planet, so the time is now. So we no longer have time to wait. So don't wait until we'll have the injury time to make something into actions. So even it's just a small steps, but it's considered is going to be a big impact to the planet. So it's a time for us to turn knowledge into action. Okay, we have to make sure that we try to walk the talk. Okay, we have to make sure that everything that we are pledged, we are saying can be turned into action. So it's not about talking, discussing, but it's about doing something. So for the planetary health, okay, I would like to highlight again, okay, we have to collaborate, and also collaborate. And please don't let the ego, okay, can prevent from us to collaborate. So, and also at the same time, we have to make sure that in the concept of planetary health is about a transdisciplinary approach and also the system thinking. So we have to make sure that we understand the concept of these two concepts in order to make sure that we can have a better understanding on the concept of the planetary health. So, and the last one is about we have to empower our community. Okay, we have to empower our community in order to make sure them can continue with this movement, because this kind of planetary health is not the duty, it's not the responsibility of the researchers or the responsibility of the government. It's responsibility of everyone. So we have to make sure that the community understand about the planetary health, and they can be as our support system, we can work hand in hand in order to make sure that we can preserve the planet for our future generation. So in a nutshell, okay, we commit okay, that the planetary health will not remain as a topic of discussion, as a part of the webinar, as something that we want to discuss in the written paper, but it's going to be a guiding principle. Okay, it's going to be a guiding principle in how we are going to live, how we are going to work, and how we are going to lead the institution. So I think that's all from me. Thank you very much, Dr. Aini.
Thank you to Dr. Redzuan and all speakers for the insightful sharing. Ladies and gentlemen, today our three experts have showed us exactly why those borders must fall. Dr. Redzuan reminded us that environment is not a separate place we visit, but the very system that sustains our biology. Dr. Nurolaini showed us that the medicines meant to heal us, but must be a part of a circular and healthy journey of the earth. And Dr. Iqbal brought it to home to the human level, showing us that our mental and physical resilience is inseparable from the stability of the world around us. From this vision, we now see that to empower human health, we must empower planetary health. Without that, we say, distinguished guests, ladies and gentlemen, I would like to invite the director of the Institute of Planetary Survival for Sustainable Wellbeing, International Islamic University Malaysia, Professor Technologist Dr. Lokman bin Ahmad Isa to deliver his closing remark. Professor, please welcome.
Okay, Assalamualaikum warahmatullahi wabarakatuh, and very good afternoon to all of you. For all the Muslim friends here, we are about 2 hours nearly about 2 hours for us to break our fast. Alhamdulillah, we have done our journey of 1 day of symposiums webinar. So thank you very much for all the speakers. In the morning, Dr. Fatimah from Sunway, Dr. Naim from UMS, and Dr. Saengduen from Mahidul, having given talk about the health empowerments. And then this afternoon, our moderator, Dr. Aini, with beautiful, powerful panelists, which is Dr. Dayanku Nurolaini, Dr. From UBD, University Brunei Darussalam, Dr. Iqbal from University Pajajaran, and also Dr. Redzuan, my deputy. So I think we have covered up everything about the planetary health, as we know that planet is the one place that we are living. We have no choice. We have to work on this. And then when we're talking, when we're talking more about the planetary boundaries, Dr. Naim mentioned, so now we touch already sevens. We have 9, but we touch already sevens, 2 to go, to ensure that we are making a lot of disaster in our planet. So that's why we have to work together. When we're talking about the planetary health, again, I want to stress out here that no more in silo. We have to work together, integrate, collaborate, transdisciplinary, and then system thinkings. Because we start now in our university already to ask the student about thinking collaboratively, thinking wholesomely, in order to ensure that we will have a holistic solution, a better solution. Sometimes, somehow, we have limitation because we are in the level of university. In terms of the governance and the governments of our own country itself, maybe we don't have enough hands to touch or to make some kind of difference, to make us change. But then maybe we can foster our students to ensure that our product is something that understand about sustainability, about how to preserve our nature, balance the urbanizations with the environmental stability, to ensure that we having a sustainable well-being. And then when we're talking about sustainability is in line with the Islamic thought and all religion thoughts, I believe, that we have to ensure that we are doing something properly and by heart. Our initiative has to be done by heart, and then to ensure that we think about different angle to ensure that whatever the situation, whatever the solution that we do is something that could benefit every kind of us, not just human, environment, and also the biodiversity. So again, I want to stress out again that we are now establishing the regional consortium of planetary health of Southeast Asia. Maybe we can name it properly after this. We're going to have like a meetings soon, and we will call all the university that we having this kind of linkages so far, from Indonesia, from Brunei Darussalam, from Thailand, Philippines, and also Vietnam is the latest one. Yeah. So I hope that we can work together to ensure that we can achieve some agenda that may be focusing more on university levels, having like a similar master program related to sustainability and planetary health, or maybe we're going to have like a mobility student stuff, and then also research, getting some kind of grants internationally together, and then because we have to understand that in Southeast Asia is the richest biodiversity that we have, the tropic area, which actually the main focus that we have to do, because all over the world, this is the main focus, so-called like the sources, the oxygen sources for the world. So we have to ensure that our rainforest still intact and still in the good condition to ensure that we can inherit our world into our next future generation. So that's why we have to work together to ensure that we can produce, even we still young, I believe, we can produce the young generation, young leader to ensure that we have different thought, and then we will rule the world sustainably. And then also we will have the regional postgraduate symposiums on planetary health 2026. Again, this one also collaborations with the countries, the Brunei, Malaysia, Indonesia, Thailand, in Indonesia, Vietnam, and Philippines as well. So this is like so-called the first action or the first executions that we want to do together in terms of the establishings of that consortiums. Yeah. So maybe every one of you, I urge that we can start contributing and working together in this regional postgraduate. For this time, we will do online, but sooner, maybe next year, we can do face-to-face, and we can mix around better when we do face-to-face, or even we can do not just in Malaysia, we can change our venue to different countries among us. Okay, so hopefully that yeah, like Dr. Nurul mentioned just now, is not just it will not end here, and it is just like a first step for us to ensure that we are taking care about our planets, and we will talk more about the planetary health in our life. Yeah. By then, I thanks everyone, and till we meet again, Assalamu alaikum, and very good afternoon to all of you. Salam.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Professor Technologist Dr. Luqman bin Isa, for those visionary closing remarks and for your unwavering leadership in the establishment of regional consortium of planetary health. Your vision transformed today's dialogue into a roadmap for the future, ensuring that we continue to work as one unified for the health of our planet. Ladies and gentlemen, let's take one picture for our memory of this wonderful gathering. Therefore, I would like to invite all of our distinguished speakers and all participants to please turn on your camera. Okay, smile. Let's begin with 1, 2, 3. One more time. 1, 2, 3. Thank you, everyone. Ladies and gentlemen, we hope you live today carrying this commitment forward, recognizing that every choice we make anywhere in our daily life ripple across the borders of our ecosystem. Because at the end of the day, we must remember we cannot be healthy inside if our home is sick outside. Therefore, I would like to extend our formal gratitude to our speakers for their intellectual contributions and to the organizing committee for facilitating this vital forum. Most importantly, thank you, the audience, for your commitment to this well-being without borders movement. Let us carry this insight back to our respective institution and transform this conversation into a catalyst for systemic change. Before we depart, few brief announcements for all respected guests. You are invited to fill the feedback form to receive the e-certificate from us. And also for IIUM participants, you are required to fill in both forms in order to be awarded with star points and CTD points. And to stay connected, I encourage all of us, our respected guests and also speakers, to follow our social media channels for latest updates and initiative on planetary health. And lastly, on behalf of Institute of Planetary Survival for Sustainable Wellbeing, I would like to thank our collaborators, University Planetarian Indonesia and also University Brunei Darussalam, for making this forum successful. Wabillahi taufiq wa hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Thank you and a very good day, everyone. Happy Ramadan.
Okay, thank you very much. Thank you.
Prof. Thank you, Dr. Nurolaini. Thank you, Dr. Iqbal. And thank
Thank you,
you,
Prof.
Thank you so
Redzuan.
much, Dr. Nurul, Dr. Nurolaini, Dr. Redzuan, and Professor Luqman.
Thank
Thank
you.
you.
Salam Ramadan.
Salam Ramadan.
Selamat Ramadan.
Yeah.
Assalamualaikum. Oh, Dr. Rizwan, so nanti kita boleh lanjutkan perbincangan mengenai itu ya. Saya nak hantar student.
Ya, boleh. Nanti kita di WhatsApp.
WhatsApp ya, okay.
Ya, saya ada WhatsApp, Doktor. Right.
Okay.
Okay,
Thank you, everyone.
Thank you
Yeah,
very much to everyone.
Assalamualaikum.
Assalamualaikum.